Good afternoon. Dr. Al here, ready to talk to you about the importance of chart notes and charting. I'm going to be discussing this today because charting and chart notes is a real key function that we ask our dental assistants to participate in the office. As dentists, we're bound by law to keep accurate records of our patients. That includes their chart notes and also their charting and what happened during the day. And we're required to do that for all of our patients, or else we can't keep a license, all right? So we delegate that to our staffs to be able to help us do it because it's an enormous project, okay? And the truth is, whatever we write in our notes is what we really consider as the truth and actually what happened for that patient. For example, I don't remember what happened to my fifth patient I saw 4.5 months ago. That's just not something I can recollect and remember. So we keep accurate notes and records so we can go back and look at our patients, see what their needs are, and maintain those, okay? And it's so important to have correct and accurate notes because whatever we write down that day, whatever we did that day, if it's not right, then several months later or a year later, when we look at it, we're going to assume what we wrote down was correct. So it's so important we make that day of. And that's why our doctors really focus on creating, signing accurate notes the day of the appointment. We go to great lengths to make sure that happens day in and day out. And we ask our staff to help us write those notes at the time of the procedure. So as soon as the procedure, as soon as the treatment, as soon as the exam is over, we can sign the notes immediately. Okay. So that's really the key focus of this training today, is to help just highlight some of the basics of charting and chart notes as you're a new dental assistant and be able to understand how important it is to keep those notes accurate, okay? Well, the first thing we're going to do is we're going to start by discussing basically looking through the charting that we use in our current office and in our current system, okay? So here I have, I'm going to bring up the screen here of a patient. Abby, all right? So here's Abby Burns. This is my daughter, all right? And her charting. Of course, this is going to be our fake template that we have today that we're going to be using to discuss charting and chart notes, okay? And so what you have here is our Denticon screen, which lists a whole bunch of different stuff. But here, especially, you see this section right here with these tabs. And this kind of is all the things that are in the patient's chart. You've got under the patient's name, Abby Burns. And then here is the different tabs you can look into. And we're on the restorative chart, the very first one, which is where we spend most of our time in the clinic, is looking at the sort of chart for the patient, okay? This shows her teeth. This shows what's going on in her mouth. And is a graphical representation of what she has going on, okay? So, of course, we can manipulate and change this and make it whatever we want it to be to match our patient. And that's what we do is during our the checkup exams or a new patient exam, is one of the first things you do after you've done taking x-rays, after you're kind of moving through the process, you get to the step where you have to update the charting on the patient. And that's where this comes into play, where you want to make whatever we have here on the chart represent what is in their mouth, okay? And so that's what we need to do, all right? And to do that, we have a couple different other tabs you can look at. We have over on this side, we have pre-existing, we have the completed, and we have the treatment plan, okay? Pre-existing is what is shown in the patient's mouth, what's going on right now, what they have. Completed is what they've had done by our office, and treatment plan is what they have to come or need to have done later, okay? So let's talk about this for a few minutes. Let's start first with the green, the pre-existing, okay? So let's say Abby, we look inside of her mouth, and this patient here, it shows that she has all adult teeth, but let's look and see that maybe she's got still some baby teeth. Maybe she's also got a set of baby molars, so, like a common, maybe a 10-year-old would have, all right? And so we can go along and we can click on teeth and we can highlight them and select them. Or we can come along and over here in our options, once we've selected them, choose what we want to do. And we'll say, for example, right now that those are baby teeth, so we're going to make them baby teeth here. And we'll turn those baby teeth into baby teeth, all right? And you see they look smaller, and that's how we show on our charting. And so you'll become very familiar as you become an assistant office how to change and manipulate these teeth and change them between baby teeth, adult teeth, missing teeth, teeth that haven't come in yet. Those are all things you need to be comfortable with in adjusting that. And that's why they have all these tabs over here. Again, for example, I click on this, I got lots of options of things I can do. Maybe this tooth has an area we want to watch because we're concerned about a cavity being started. So I click on the tooth here, I come to conditions, and it allows me to choose the various different things we can look at on this patient, okay? Maybe it's the surface of the tooth. So instead of clicking the entire tooth, I'm just going to click on one of the surfaces here. So I've got what we call the mesial and the occlusal. And let's say I want to keep my eye on those two areas. The doctor says, I want to do a watch on the mesial occlusal tooth number 12. You'll click on those two spots, you'll hit conditions, they'll come up and you'll be able to put in incipient decay, which you click on that, it makes this little dark spot on the tooth, and black means we've got to keep our eye and we're watching. It's not a cavity in place. We're going to be highlighted and watch closely for down the road, okay? So here we've adapted, we've changed some of the teeth, adult teeth, baby teeth, so on and so forth. And there's lots of ways to go through and do that and change those teeth, all using these buttons and having them through that process, okay? So, of course, you're going to learn how to, what the numbers of teeth are, the letters. As you can see, baby teeth are letters versus adult teeth, which are numbers. And you learn to adjust back and forth those. And that's something once you practice and you're comfortable with changing baby teeth, adult teeth, so on and so forth, and be very familiar with that, okay? The other thing you're going to know is the surfaces of the teeth, okay? What represents, as I said over here, the mesial, the occlusal, the distal. Here we have the buccal and the lingual, and learning how to be comfortable with those different surfaces as well. Is really key and important, so you can do the charting for a patient, okay? Now, as far as the section over here, we go back over next to the ignorance is pre-existing. Completed shows what the treatment that's been done, but to be honest, in our office, that's not a function we use ever or really ever need to get access into. So technically, you only have to worry about learning about the pre-existing and then the treatment side of the chart, all right? So let's talk about the treatment side of the chart. Let's go and click on that. When you click on that, it brings up the red area, all right? You can see these different options. And this is where it allows us to put items that need to be done for the patient. So here we are, we're doing the exam. We've checked the patient's teeth out. You're sitting there on the computer. You've got one, your glove on your left hand, ready to hand instruments. The right hand's clean. It's on the mouse, and you are updating information into the patient's chart as the doctor speaks and talks. You're multitasking that situation, okay? So let's go back here. Let's say, that watch area that we had on the occlusal mesial from last visit. Now this time we need to fix it because it's turned into a cavity. So here we're going to click the occlusal, here we're going to click the mesial, get them highlighted in that gray area, and then we're going to come over here to restoration, and we're going to click on that. It's going to bring this next room. We have options, and we're doing a composite filling. So we're going to click on the composite, and it will load that in to show that we have that treatment to do on that tooth. Let's say tooth over here needs a crown. So we click on the crown of the tooth, we come over to crown, we click on that, and all of a sudden it pops up several different things, different options we have. Let's say we're doing the stainless steel crown. So we click on the stainless steel crown, and we'll place that on the tooth over here too. So now we've got two teeth in treatment, okay? So that's how we're going to be entering treatment in, is by using this graphical representation, the buttons, to show how it all works, okay? And that shows that this patient needs a little bit of work to be done. Now, it's important here to know this time that we have a treatment plan or treatments that need to be given. So we need to finalize that treatment plan. And one of the tabs over here, the fourth one from the end, the fifth one from the end, you click on that one, and it will show then the charting in a graphical form like this in a list. You see there it is, tooth number 12, the emerald composite that needs to be done. Tooth number A, the stainless steel crown, okay? So that shows you the treatments we've planned. Now, all of our patients in the office are going to either have generally nitrous, sedation, or general anesthesia. Those are the types of treatment appointments that we have. And so to determine how you're going to add that on, are we going to use a nitrous, sedation, general anesthesia, are all things you can go down here in this code section, all right? So as you come in here and you can search in various different ways about various things you can put in. I'm probably clicking the wrong one here. Just going to use your code NOP for nitrous, all right? I type NOP in, it brings up nitrous. I click on that, and it populates it in. You see now we have a third thing on the list, okay? So that's a possibility to do this. Now we have one visit set up with two teeth to be fixed with nitrous. That is ready to go. But let's say maybe we don't want to do both those teeth the same day. We want to split that up, all right? So there's a way to what we call phase the treatment, and that's over here on this side, where we can come along. Let's say if we want to do the second visit, I'm going to right click on this, date, area right over here. Come on. Oh, I'm sorry. Gotta click the check. I apologize. Click the check. Then you're going to change it. It's going to say change ID. So you go to change ID. The treatment plan ID is always 1. All right. The phase ID, if you go to 2, that's how it says on a different day. All right. And the order is always going to be 1 as well. All right. So I'm going to move that A crown on tooth number A to the second day, which we click on all that. And there you go. You see the PID, or the phase has changed. So there's 1, 1. 1 for the composite, 1 for nitrous, and then for 2, there's the stainless steel crown. Of course, at that stainless steel crown visit, maybe I want to do a sedation now. So I'm going to come down here. I'm going to take off the NOP. I'm going to put in the sedation. It brings this up. I add that on. And now I've got this. I've got my composite, my nitrous together in 1. And my oral sedation is, it's also the first visit. So I need to change the ID there. So I'm going to click here, right click, change the ID, come down to 2. And now I've got, right here, you can see the A and the sedation at 1 visit, and the 12 and the nitrous. So just a simple example of a plan. Now, At this point, I've decided I don't like this plan. I'm going to scrap it. I'm going to come along here. I'm going to basically click on all four of these things, and I'm going to delete them. And as I delete all those things and they come off, I go back over to my restorative chart, and guess what's disappeared? Everything clears off, and we're back to kind of where we started, with no treatment really on her chart whatsoever, back to just having that watcher there. Okay, so you can see moving in and out of the chart's important to be able to kind of set things up. And this is just a very basic, simple example of what you're going to be more comfortable in doing, and how to input all the types of treatment that we do in the office, how to use those buttons. So you've got that. But in the end, what this represents to us, this graphical chart represents exactly what the patient is going to need for their treatment, or what they've had in the past, or what their current circumstances. And in our office, what you really have to do is be able to sit down with that patient, look in their mouth, and really figure out what they have now, particularly which teeth they have. Kids' teeth are constantly changing, their mouths are constantly changing. And so being able to determine baby teeth from adult teeth, what's in now, and updating that is really something important for the doctor to be able to have. So when they sit down, they can get started on what's going on in the mouth right now, okay? As you're new and you're learning that, we will help you through that process so you get more and more comfortable in doing that and feeling like you can do it all on your own, okay? But that's the big first half of our conversation here, is the charting. What we're doing inside the charting for our patient to make sure everything looks like it is supposed to, okay? So as far as things go here then, what we're gonna click on next as we're looking at our chart here is gonna be over looking at the progress note. This is the second major part of the patient's record. Before I jump to it, you'll see a couple other things. You'll see perio charting, which is something we do not do in pediatric offices. You'll see the x-ray, which you become very familiar with in both obtaining and looking at x-rays. That's in this patient chart module, all right? We talked about the treatment planning, and then medical history, something you get experience in, which gets put in at every single visit and updated. Not for this video, but we'll talk about that later time. The progress notes, okay? So the progress notes, click on that and move this into phase 2 of our conversation today, all right? So here we have, a note from before, but you'll see here on this screen, and this is basically what we have done for the patient in the past, okay? It's what's going to be on here already, okay? And so what we're going to do is, as far as this conversation is concerned, we're now going to look at what the representation in a written format is. That is what the progress note is called. We call it a progress note or a chart note, and that basically tells us what the patient in a written form has had experience. And this is so key and important every single visit, because this is where our administrative team, our financial team, look at records to make sure they match up with billing and insurance, okay? So it's real important you have great progress notes, all right? So let's go ahead and take a look at those progress notes real fast, okay? So here we are with the progress note, okay? I pull this up, and let's say we're gonna be starting a new note for this patient, okay? This is your first patient you're seeing, down here at the bottom, you see this add new notes. You're gonna click on that. And what's going to happen is it's going to bring up this screen, okay? This is a blank, empty typing space, plus we have what we call macros or templates that are over here, all right? So let's say we've got Abby here. She is a teenager, so what we're going to do is we would come over and click on her macro, which would be a teen, all right? And under all of our macros, once you click on this, it'll bring up this little sort of preview, and you'll hit add to notes. And then it brings up a list of questions. And these are things you're going to have to be good at understanding and knowing how to put in. One, of course, is the doctor, all right? Which doctor is seeing them? What dental assistant is you are? So you'll click on this and your name will pull up, and you'll hopefully be able to find your name on that list, okay? The exam type that we're doing for today, whether it's a new patient or an ongoing or a continuing care visit, you'll click on, okay? In this case, we'll say Abby's here for a continuing care visit. Who came with Abby today? Who is the guardian there? We'll say her mom came with her today. And then risk factors. If she high or low risk, these are things you'll learn as far as things go once you learn how to do our report cards and determining what's a high or low risk patient in the office. Next up is the x-rays that took place during the day. Let's say for Abby, we took a panoramic x-ray today. She's got that, and so we're gonna add that to the list, okay? And then her gum health. What she is a teenager, we rate gum health. And so here are a couple of different options for her. We'll say that maybe Abby had a 0 healthy and less than 3 million probably dip. So she's a pretty healthy patient that way. And then her behavior. And you can see the different options we have there. We'll say that we'll say she's cooperative in details. So we'll say the Frankel 3. Then you're going to say you're going to add this note. So, and then we'll populate in this text area all this information about the patient. And this information is what we're going to be editing through the course of the appointment. All right. So for this patient, of course, we've been doing our charting, and now we're kind of wrapping up with that. We're going over to what is the progress note and entering information is. You'll look and see there's different sections here. We've got this first section that shows the doctor's name and the assistant. Those are important to be accurate, of course, for billing purposes. Make sure you know and got that written down properly. Then there's what we call the patient section and the diagnostic and preventive services section. These two sections are the sections that assistants are in charge of, right here and right here. And as you go into them, you need to verify each line is correct, all right? That they're here for a continuing care visit, that they came with their mother. And then you'll see these areas have got these little sort of like dashes in them. These are the fill in the blank spaces where for a teen patient, you take blood pressure, you take their would be heart beats per minute. So that's information you would come along here. They'll come and you'll actually type in that information as you're editing, okay? 1/70, so on and so forth, okay? There's also a place to update their health history, and then any other information you feel like is important to share in the note can go here. The most important section, however, though, for a dental assistant is this next section, the diagnostic and preventative services provided. This is the list of things you did for the patient over the course of their appointment. It's kind of like a grocery list or a shopping list or a receipt, all right? This lists everything you did because all the items that are on this list are going to go onto their receipt for the day when they check out and when they pay or use their insurance or whatever it might be. So it's important that this is accurate and represents what they received, because we don't want them to pay for more, nor do we want to pay them for less. We want to be exactly what they had, all right? So making sure that their risk assessment that we have done is correct. We've done their whether x-rays are in their original list. In Abby's case, we just took the panel, but there may be 3 or 4 other types of x-rays we took for her. It could be on here. We did an oral evaluation, we did her cleaning, we did her fluoride, we rated her gum health, which is on here. We took intraoral photos, which are on here. And then we gave her anticipatory guidance, which is basically feedback and coaching on how to take good care of your mouth, which we do with all of our patients. So that's kind of a long list of things. And if, for example, if she had seamless done this day, we'd come along here and we would actually add another line and we put in, number 2, number 3 was sealed. Okay. So you can add text in and out of this very, very easily. You can delete it as well. Okay. Now, the spot below is the diagnosis and next visit. Truthfully, in the end, the doctor has responsibility to make sure that these 2 areas are complete and correct, okay? Now, if it's simple and straightforward, or you have experience and you fill this in for the doctor, they'll probably greatly appreciate that. But it is up to the doctor to verify these 2 things are correct so that the next visit is set up the right way for the patient next time they come, all right? There's a behavior scale, which we write down how their behavior was for the day. We talked about Abby, that she was a cooperative helper. Then we have the exam results, which go into various different things. You've got an option for just leaving this all by itself right here, which means that the patient had no decay. We've got areas where teeth we're watching have staining, or what we call demineralization, where cavities are trying to form, which we can note here. In Abby's case, it was tooth number 12 that we saw that had an area that was kind of like that. And then, of course, we've got options to do sealants, other restorations or cavities being filled, extractions, so on and so forth. And this type goes on, you get more familiar in filling in those blanks and spaces with what that patient needs. And then there's a place for the doctor narrative. And this is where the doctor writes their own personal notes for this patient, individual for them, all right? Then last of all is the next visit, where they're coming back for, whether it be another, in Abby's case, 6 month continuing care. Do you have any cavities, right? But when we did make it, so she had cavities, her next visit, we talked about her doing a nitrous next, so we just type in NOP. So that would be her next visit, okay? So again, freehanding, be able to write this stuff in is really important. So that's how we create the note. And by the time the examination is done, and the time you've been able to talk through everything for the patient with the doctor, you should be able to fill out most of this, if not all of it, okay? So by the time it's all done, it's complete, it's all set, then the doctor can come along and they can come in here and they can sign the note, okay? Or they'll load in their name, their password and username, and then be able to sign the note, okay? So to that effect, all right, back to kind of where we started, right? You're multitasking here. You're putting the charting in, you're putting the progress notes in, you're doing all these things while the doctor's talking with you and going through things with the patient. It's a lot going on at one time, all right? And especially for patients who require a significant amount of treatment, there could be a lot of information to put in for that patient at that time. Inevitably, what happens, especially if you're new and you're not used to the pace and the speed and all these things happening all at once, is the doctor turns around after doing their exam and talking to the family and creating the plan. And what are they ready to do? They're ready to sign the note, all right? chances are you're not ready for them to sign the note. You still have stuff to enter in. The computer work is not finished, okay? So I want every assistant to know when they first start in our practice is it is so much better to slow down, do things right and correct, and sign the note later than it is to rush through it, make mistakes, and sign the note quickly. Because undoing those things, fixing those notes, creating what we call a note correction is a real pain in the neck. It's really hard to fix it. It takes a ton of time to fix it. It's a big waste of time. And so we want to make sure you understand that as you create these documents, you create these legal documents that are documents for signing, you make sure that you do it in the right way the first time so that we go back and sign. It's okay. We're all set. We're squared away, and it is very accurate. So every assistant should be able to say the following words. Doctor, I'm not quite ready for you to sign the note yet. Do you mind giving me a few minutes and coming back around, and I'll have it ready for you in about maybe 2 or 3 minutes? Is that okay? And then letting the doctor answer. All of our doctors are nice, kind, and understanding that we're asking our assistants to do a lot. And they will say, absolutely, I'd be happy to come back around and sign that later on. And even if they forget to come back later on, guess what? When we catch that, at the end of the morning, at the end of the afternoon, and the doctors will get the notes signed. Please make good notes. Please make the time and the effort to make sure our records are accurate for our patients, because you know what? A few months later, we're not going to remember. We want to make sure we do that for them. And that's where we all started today, about the importance of these documents and how they're accurate. They're important for our doctors, for our licenses. They're important for our patients and their fees and their health. Let's make them important to everybody. So there's my my lecture and spiel for today. I appreciate you all joining with me, and hopefully this has been helpful and instructional.